Oh, hi, I'm Zaf. Well, most people call me Zaf, but I'm Dr. Zafarullah, a pediatrics intensivist working at Birmingham Children's Hospital. And I have been a volunteer for Chain of Hope from 2010 when I started my first mission to Aswan in Egypt. It was very, it made quite an impression on me working in a less developed country and seeing the work that is being done for children with congenital heart disease. Since then to now, I've done probably over 100 missions from 2010 to now to many countries across the Caribbean, across Africa, and also as part volunteer with Gift of Life, where I volunteer as a Chain of Hope intensivist across Latin America as well. How did I first hear about Chain of Hope is that I had friends working at the Royal Brompton when I worked as a trainee in London before moving to Birmingham. And I stayed in touch with them and they were able to tell me about the work that Chain of Hope was doing. So once I started working in pediatrics intensive care with an interest in cardiac, I thought, why not volunteer? Because I was volunteering for other organizations previously. And that's where I really got involved. And what I think I really like about volunteering is the vision that Chain of Hope has for the countries that we volunteer for or in. And this is really working with the local team to try and develop and build capacity. And so with that vision in mind, I was really excited to bring a number of my other colleagues along with me, because it's not just going out to the countries and doing cardiac surgery, but also trying to build programs for them. There have been a number of cases, as you can imagine, that really leave an impression on me. And one of the cases was in Ethiopia, where a child was brought by his father. I think they traveled like 350 miles in a little van to get there. And his heart was really, really complex. We did a double valve repair for him, the local team, but he was extremely sick, and we thought he was going to not make it. And he came back to the intensive care, and I'm really in admiration for the nurses in Ethiopia, the intensive care there. And we have done a number of missions and trained them. And we were able to support this child, this 12 years old child, back to recovery. But to see that he's recovered and returned home with his family, that is something that really keeps me returning to these trips, to be able to give the opportunity for children in low resource countries to be able to have an equal opportunity to life. Thank you very much.